Hi, I'm Joel Rothfeld, a neurologist associated with Enloe Health. Can you recognize the signs of a stroke? The signs of stroke have been reduced to an easy, recallable acronym by the American Heart Association, and the acronym is B FAST. B stands for abrupt imbalance, specifically a spinning imbalance. E stands for eye changes, which can include loss of vision in one eye or both, or double vision. F stands for facial droop, particularly lower facial droop. A stands for arm weakness, where your arm cannot work or it's totally flaccid. S stands for speech change, and T stands for time, meaning the sooner you get to an emergency room, the more appropriately you can be treated. So remember, stroke is a medical emergency, and call 911 immediately so you can get the most rapid therapy and rescue your brain from further deficits. Do you know that 80% of strokes are preventable? To reduce your risk from stroke, you can take several easy steps: controlling your blood pressure, controlling your blood sugars and avoiding diabetes, healthy diet and exercise choices with reduction of cholesterol and other bad lipids. Reducing smoking and complete smoking cessation will also go a long way towards reducing your risk of stroke. Do you know that there are several different types of stroke? The different types of stroke include hemorrhagic strokes, which are bleeding strokes in which a blood vessel ruptures in the brain, and a non-bleeding stroke referred to as an ischemic stroke. The third type of stroke is known as a transient ischemic attack, abbreviated as a TIA. A TIA can be a stroke warning sign, or it can actually be a very small stroke. Talk to your provider if you think you're at risk for a stroke. You may have heard the term hemorrhagic stroke, but what exactly is it? A hemorrhagic stroke is the result of a ruptured blood vessel in the brain, causing blood to extrude into the brain tissue. Hemorrhagic strokes have several symptoms, specifically sudden onset, which might include loss of consciousness, severe headache, nausea and vomiting, and abrupt loss of motor strength. Recognizing the signs of a stroke can be life-saving. Why is it said that time is brain? In the average stroke, one will lose 7.5 miles of interconnections between nerve cells, as well as 14 billion synapses, the interconnections between nerve cells, and approximately 56 million nerve cells. Time is brain, so if you're able to recognize the signs and symptoms of stroke, you can go a long way towards reducing damage to your brain by calling 911 immediately.